All right. Thank you, Ryan. You're joining us today. We just have a couple questions for you today, if you don't mind. Ovation Healthcare has a long history of supporting rural hospitals. Can you kind of share what are the main service lines and how you help these rural hospitals thrive?
Yeah. We've definitely changed over the 50 years of existence, starting out as a management company, part of Columbia HCA, to today, we're focused on shared service lines that help hospitals remain independent or sustainable. We do that in 4 key areas. We start with leadership advisory, where we might come alongside with clinical or financial strategy options. We have a spend management, so we have a GPO, white glove service with things that are really important for hospitals, like how do you navigate 340B and the changes there. We have a revenue cycle complete, front to back end revenue cycle service and an IT team. So we come alongside hospitals and help to fill gaps they might have so that they can continue to remain autonomous and sustainable.
Excellent. How do the service offerings at Ovation differentiate itself from other competitors in the marketplace?
Yeah, I think the key way is that rather than some of these services are kind of transactional in nature, like revenue cycle services, it's kind of, send the bill, collect the money. But I think what sets us apart is the ability to come alongside the hospital and help them to understand how their service model might need to be enhanced to attract more customers, to keep people local, to help them position themselves. And so we can come alongside hospitals and offer ways to not just improve a specific service, but we can come alongside and help them to improve their perception and relevancy within their community.
Looking forward, it's always hard to predict, but if I'm shaking the magic 8 ball there, what kind of strategic advice were you giving to clients for 26?
Wow, that's a big one. I think in 26, it's about taking a step back to let the dust settle. And when you're doing that, it's trying to look out onto the horizon to imagine, okay, so with these circumstances and situations maybe looking a little wearisome, whether it's workforce challenges or whether it's reimbursement challenges, it's to take a step back and to kind of take that opportunity, similar to kind of restarting hospitals after the pandemic, is to how can we reimagine ourselves in a new world where we need to do things a little bit differently. And maybe we need to have a few more partners around the table to solve the problem. Because at the end of the day, I think healthcare is just going to continue to get more complex. And so why not start in 26 with the idea of maybe there's a new way of solving this problem, so maybe we should listen to a few more voices before we act.
That's good. I hear a lot when we're talking about collaboration, partnerships, and that makes me think about alignment and how can you partner with providers in the marketplace and maybe in different communities. Have you guys been seeing any trends with provider alignment?
Yeah, I think with provider alignment, it becomes harder and harder, I think, depending upon your situation or where you're at in the marketplace. And so I think, providers are asking for some real concrete changes in their workflow and their work patterns. And so I think how I'm seeing them align differently is things along the lines of, what does access look like in my clinic? Can we have a longer day and a short day? What does it look? What does family balance look like? And those things really do kind of fly in the face of some really staunch, hard realities of how medical school and training has worked in our country for a long time. So I'm seeing hospitals have real conversations about what does it look like for access in our community? How does that fit into workflow? How does the electronic medical record and the way to capture information and make sure that we're closing gaps if you're a Medicare Advantage patient, to make sure that you're maybe taking advantage of the wellness offerings if it's a commercial patient, really just focusing more on the realities of here we have a great person that's taking care of our community, and so maybe we need to look at things a little bit differently.
Are you using, you mentioned access there, are you using telemedicine in any of these provider alignment or workforce strategies?
Definitely trying to where you can. And so I would say that might be something as well on that 26, what's going to happen from some of the federal regulations that sometimes they're relaxing, sometimes they're more stringent. So I think from telemedicine, definitely having some conversations with even some specialists that are looking to create some regional networks, because this example would be neurology, where it's really hard to have a neurologist in every community hospital. But if you have 4 or 5 neurologists that can provide that ED coverage for a consult, then you can kind of hardwire some of those protocols, whether it's TPA protocol and transfer, or even one group is actually looking at what does it look like to have access follow-up clinics. And so I think that things are definitely changing. And I think that that's a great thing for our communities, because it creates a level of access that wasn't there originally.
Certainly agree. I've seen a lot of movement in the hub and spoke. Neurology is certainly a space. I think telemedicine's been pretty hot in that space as well. We're going to go ahead and pivot a little bit here. We're going to talk about the new exciting partnership with Ludi and Ovation. Would love to hear from your perspective why and what's so exciting for you on this partnership.
Yeah, when I first saw the tool, what really excited me was that this becomes an option for our clients to consider that really helps close one of the compliance gaps that exists within physician compensation. I don't know of a client that we have that isn't using some Microsoft 97 version Excel spreadsheet started 25 years ago that they've adapted over time. And so mistakes happen, right? When we have humans entering data and you're on 3 different EMR systems ago platforms that you're pulling data from. So I think what really excited me was just being able to come along clients and say, hey, here's something that can make your life a little bit easier. It can help you to be compliant within the regulatory environment, because it seems that more and more letters are going out around whether it's physician compensation or price transparency. So there's definitely more watchful eyes. And then truly just how easy the tool is to use and navigate. The customer service that the Ludi team provides has been outstanding for our clients.
Love hearing the positive feedback. We're mutually excited for the partnership, and me personally love hearing about services in the rural health area, rural communities, just from my background of having a farm in rural area. So I love hearing that. We're thinking about Ludi and Ovation, the partnership. What type of synergies and complements do you see in this type of arrangement here for the service offerings?
Yeah, I think it's a wonderful synergy, because a lot of times we're working with clients to let's standardize the physician contract. Let's work on the process of recruitment from what does it look like to bring the physician and their family in? Who are they meeting with? And then when we think about what Ludi has to offer, you have a way of offering the hospital an easy way to track that compensation, that within these new agreements, maybe they're getting a medical director, or maybe they're getting an education stipend. So there's multiple layers of the compensation. So you're making it really easy for the client to get creative, because they're going to plug it into your tool, and we're going to have ability to track it. And then there's feedback for the physicians that they can see their compensation broken down on their smartphone, so they can submit their time. I really like the fact that there's an interactive platform that gives clients an ability to rest easy, that post-implementation, Dr. Smith is going to come in, here's here's his compensation model, we plug it in, and then there's good reciprocity of understanding that there's no question, so we don't have issues later on.
Yeah, you mentioned the transparency from a provider standpoint. I know providers loving having insights and transparency there. And then also a piece of an administration piece. But I think one of the highlights is, from an administrative perspective, you're able to track time, and also not just only from a compliance perspective, it can be used for your cost reports and to help make sure that you're maximizing the opportunities that you have on the cost reports there. Yeah. Do you have any other kind of thoughts on how that can be used there from your perspective?
Well, definitely not a cost report expert, but our team members that are the experts for critical access hospitals, they are always educating our clients around, you have to be able to pull this data, you have to be able to pull this report. And so I think the tool that Ludi provides is going to make the reporting mechanism a lot easier for clients to use rather than trying to go through and scramble at the last minute to make sure that they've got a way to track all of that time that their physician has spent doing those reimbursable activities.
Excellent. One last question for you today.
Yeah.
What do you think, what does your family think that you do when you come home from a long day, you're relaxing with the family? Yeah. What do they think that you do all day?
They think I talk on the phone all day. They think I'm a telemarketer. So when my kids were little, they would be like, why are you talking on the phone all day? Like, what are you doing? And so it's been fun as they've aged. And now that we live in a virtual world where we have a lot of Teams meetings, it's fun to have my kids kind of pop in, and maybe they'll see you someday on the other end of the screen, that they come in and out. That I think that's fun to be able to show our kids what we do. And now that we have a lot of technology that they can kind of pop in and pop out, and it brings a level of humanness to our experience.
I would say that's pretty similar in my household. I live on the West Coast, so there's a lot of 6 a.m. calls. And then my other half, she sometimes is like, do you do anything else besides, jump on a call and wake me up early in the morning? And I don't know if I do.
Do you make the coffee?
I do. I actually get the coffee going. So I help out. So
yeah, that's right. You're a professional barista.
It is my side god. Excellent.
Awesome.